welcome, and I'm pleased to be here and to tell you something on new developments, how to treat, or better, how to prevent dementia, especially Alzheimer's. And there are new developments, and together with my colleague, Dr. Tiedemann, we put that together and wrote that book. So, well, you all know that Alzheimer's and all other dementias, it's a growing problem. You see there is an increase in the incidence in elderly, and this is in the situation in Germany, and it is estimated that in 2050 we will have a peak here of 700,000, and in total 1.5 million patients with Alzheimer's. Well, I don't want to go into biochemistry of Alzheimer's. You will hear something on biochemistry tonight, but well, you all know that in Alzheimer's disease, there are two main problems. This is the development of the so-called beta-amyloid plaque and of the so-called tau fibrils. And well, these deposits in the brain, they inhibit the transmitters and they inhibit all essential functions in the brain. And so up to now, most research has been done to see what happens if you could avoid the development of these plaques. Unfortunately, up to now, nothing was successful. It is now known that there's another problem in Alzheimer's disease, and this is connected to the use of energy. Of course, our brain needs a lot of energy. 20% of the blood is pumped through the brain, and what you see here is the use of energy in the brain. This is normal, and this is an Alzheimer's brain, and the more in the yellow and red area, the more energy is used, and you see in Alzheimer less energy enters into the, is used in the brain. And the point is, our brain needs some fuel, and usually the fuel is glucose. This is what the brain uses to produce energy. And to use glucose, it was thought that the glucose simply enters the cells without the need of insulin. You all know that insulin is needed in our body to somehow metabolize the glucose and to bring it into the cell. But it was thought that the brain is independent on insulin, but now we know this is not true. Also, the brain needs insulin. And it can easily be shown that really the insulin works in the brain. This is the energy uptake without insulin, and this is with insulin, and you see really it has been proven that the brain needs also insulin to have enough energy. And you see here also that in Alzheimer's patients the use and the uptake of insulin is much lower than in the normal brain. So a little on metabolism. Well, you know that in diabetics there's a problem with insulin, and in diabetics the insulin does not work or is not produced enough, and this induces problem in so-called oxidative stress and also mitochondrial dysfunction. This is a mitochondrion. This is a cell compartment where the energy is produced. So this is the situation in the type 2 diabetics, and this is the situation in Alzheimer's disease. And you see, Alzheimer's disease induces more or less the same problems. These age products and oxidative stress, mitochondrial dysfunction. So there is a big similarity between them. And it is also known that in both diseases, diabetics and Alzheimer's, these plugs that you have already seen, and also these tau proteins develop, and so you have neuronal dysfunction. The risk of diabetics to have Alzheimer's disease is double the risk of normal population. So, and that's the reason why, at least in the United States, Alzheimer's disease is now also called diabetes type 3. So, well, I've already shown you that really the patients use less glucose in their brain, and diabetic patients have a doubled risk. And it is also now known that the metabolism of glucose is insulin dependent also in the brain, and it is also known that the Alzheimer patient's brain produces less insulin. It is very recent knowledge that also the brain itself can produce insulin, and this ability is reduced in Alzheimer patients. So don't worry, it's not very much biochemistry, but what I want to show you, usually our brain or all our cells can use glucose, and through this mechanism, the end product is here the ATP. And this is our intracellular fuel. This is needed for everything we need in the aspect of energy in the cell. And so everything is done to produce enough of this ATP, and this is done in the already mentioned mitochondria in the cells. So the question is there if this does not work effectively in Alzheimer patients, is there an alternative? Can we give our brain an alternative energy source? And that's easy. This is a short map of the metabolism in the cell, and so you can pick anything, and this will somehow influence the metabolism of the cell. Well, of course, well, we don't know what happens if we change everything, but it is now known that we really can do something. You all know that we have these fats, carbohydrates and proteins in our diet, and we only have to deal with that. So the point is, again, here you see the ATP, and here especially you see the production of ATP. This is the most important here. So as a source we have the glucose from carbohydrates, but also we could use fatty acids that also can enter the system and produce ATP, and we have proteins. The problem is, in the brain, usually only this works, because fatty acids cannot cross the blood-brain barrier. They cannot get into the brain. So we cannot use, usually, the lipids for the brain. And we do not have enough proteins to use that. This is another problem. Well, for the brain we have this usually. But there is a physiological situation when there is no carbohydrate for the brain from the food. During that time when we do not eat, when we are fasting, we have no intake of calories, and so then we must feed the brain with an alternative fuel. And what happens when we are not eating? The production of some metabolites of fatty acids, they accumulate in the blood. So this is the days of fasting, and you see here a significant and tremendous increase in the so-called ketones. And usually, if we are eating, we do not have ketones in our blood. This is near zero. But when we are fasting, after around 1 day or 2 days, the ketones accumulate tremendously in the blood. And the point is, these ketones can be used by the brain also. And you see here data that really show the energy and nutrient uptake into the brain when we are fasting. And you see, after 1 day, after 2 days, there's a significant uptake of ketones into the brain. Of course, there's still glucose. There's never zero. If there's zero glucose, we're simply dead. But there's a significant amount of ketones that are used by the brains when we are fasting. You've already seen that. So we want to produce this ATP. However, if this does not work properly, we have an alternative. We have these ketones. These ketone bodies can also produce ATP by this metabolism. So we can use glucose in the brain and ketones. And you see this here again in the brain. And this is also very new review. Glucose is used, ketone bodies are used. But what is important for all of this metabolism, we need these mitochondria, and this is important because there are problems connected to that. So we have a system where we can use the ketones for treating various diseases, and this is already known since long. The so-called ketogenic diets are used in diabetes, in weight reduction, especially in epilepsy, in epileptic patients. This is used since near 100 years. And it is also used in cancer patients, but now you see it can also be used here in Alzheimer's disease. So the question now is what types of fats can be used. And you all know, well, I have to read that here because my Hungarian is not very good. You have the saturated fats, and then you can differentiate into these monounsaturated fats, olive oil, and polyunsaturated fats, omega-6, omega-3. You will have heard about that. And the problem is, however, in our diet also these trans fats are a problem. So there are also other parts that are important with the fats. We have so-called long chain fatty acids. These are, well, relatively long. And we have medium chain fatty acids. And you see, only coconut oil and palm kernel oil have this medium chain fatty acids. The point is, only from these fats our liver is able to produce under normal conditions these ketone bodies, these ketones. And you see this here. These are the different kinds of fatty acid in our usual oils and fats that we eat. And you see these are the medium chain fatty acid. Well, there is more or less nothing there except the butter. This contains round about 10% of the fats is from these medium chain fatty acids. The cocos fat, this is the only fat that we really have that has a high amount of these medium chain fatty acids. You see this here. This is really, there's nothing else that in our diet that can substitute for that. So eat your coconut. What you see here is that, of course, to feed your brain with coconut, with coconut oil, you have an optimal zone of ketones in the blood. However, if you have a lot of ketones, you have the problem that you slide into the system of ketosis and ketoacidosis. So there is an increase in acidity in the blood because the ketones are acidic. So, and it is known also that acidosis itself is not very good for the brain. There are a number of investigations that showed that really an acidification within the brain induces problems and might be connected to Alzheimer's. Again, a complicated slide, but you simply see this is what are the reasons for Alzheimer's. Here you see a problem with acidosis, but also here you see problems with acidosis. So it is already known that acidosis itself induces problems. Well, we can skip this. This simply shows in vitro that really changes of the pH will induce deposits of the tau protein. And so when you think back to treat patients with Alzheimer's with ketones, well, you have to consider that you have to do something against the acidosis that might develop. What are the reasons for, or causes for latent, so-called latent acidosis that we have very often already in our metabolism, and we have this problem due to our diet that we usually eat. We have high amounts of acidic food ingredients and not enough amounts of alkaline food ingredients. This mainly comes from vegetables and fruits. And it is also known that dieting, of course, then when you diet and fasting, ketones develop, and you have an increase in acidosis, but also inflammation contributes to that. And this also is contributing all to the Alzheimer's processes. And it is known since long that, of course, alkaline supplementation, as for example with Basica, really makes sense. And people starting with a Basica treatment usually say, well, I feel better. This is something you cannot measure. It's very complicated. However, one reason could be that by having an increase in alkalinity, you get rid of some deposits that already developed in your brain. We have already seen that. Again, we have in Alzheimer's disease a problem with mitochondria, because only within the mitochondria really the ATP is produced. And for the production of ATP we need a certain substance, and this is the coenzyme Q10. And you see here a situation where there is enough Q10 in the mitochondria, then there is a lot of ATP that is produced, and then you see here a situation in an old mitochondria where there is not enough Q10, and then also the amount of ATP is not sufficient for the cell. And we have a problem with Q10. Usually we can produce Q10 ourselves. Our metabolism is able to produce Q10. However, this ability declines with aging. We have a reduction in Q10. In ubiquinol, this is the same as Q10. In ubiquinol, it's simply a different word, and you see there is a significant decline. And you can imagine if you have not sufficient amount of this substance, then, well, you can put enough substrate into the cell. However, this fuel cannot be used if there is not sufficient Q10. And you see also if you supplement this Q10, then you can keep the Q10 level on, in an area where it is sufficient to produce enough ATP. So the question is how to supplement. Well, you can eat a Q10 rich diet. You need the minimum you need is 30 milligrams of Q10 per day, better 100 milligram, but the minimum is 30 milligram. And you can achieve that easily by eating a pound of sardines every day. This is what you would need. 500 grams of sardines every day, or 1 kilogram of pork meat. So you see, it's simply not possible with usual diet to have enough Q10. Our usual intake with our normal diet with Q10, with regard to Q10, is something between 3 and 5 milligrams. So you would have to change your diet tremendously. And if you have all these Q10 rich foods, the problem again is this is acidic food. So you have a problem really then if you eat a lot of that. And there is another very important substance that is needed for all cells in our body, but of course especially also for our nerve cells. This is the mineral magnesium. And unfortunately, magnesium deficiency is widespread. Usually our diet is not sufficient in magnesium. We eat a diet that is low in magnesium because our foodstuff does not contain the amount of magnesium that it formerly did. Another problem is an impaired absorption. There are some genetical problems with that, some genetic diseases, but you have to consider also that all gastrointestinal diseases could induce magnesium deficiency, and also some medications, especially the proton pump inhibitors like omeprazole, significantly reduce the ability of the intestines to absorb magnesium. And so very many people that use these drugs for years or so will develop severe magnesium deficiency. But even more important is the excretion of magnesium, especially if I draw the arrow to the front. Then you have the problem also with some genetic diseases. Acidosis drives magnesium out of the body, and the problem is the kidney is our tissue or organ that regulates the magnesium homeostasis, and all drugs influencing the kidney function will also induce severe magnesium deficiency. And now consider, in elderly people, most of them will use some drugs as antihypertensives and so on and so on. So it's not so easy to find elderly persons not using any medication. So, well, I could talk hours on magnesium. However, I will focus on the brain. And there is a very new study from Australia that is quite impressive. This is an epidemiological study where it was investigated how the intake of mineral influences the risk to develop dementia. Okay, I will explain it. These were investigations on mild cognitive impairment or minor cognitive dementia. So these are mild forms of dementia. And you see the intake of, well, there's certain models, this has something to do with statistics, I don't go into that. But you see, there is no effect of calcium. If there is the number 1, it means no effect. You see, there is some effect of iron. If it's above 1, then the risk is increased. And you see that you have a 50% increase in risk of dementia if you have a high iron intake. But what is really nearly breathtaking if you are in research on magnesium, if you have a high magnesium intake, you can avoid the risk to develop dementia by more than 90%. You can reduce the risk here by 92%. This is dramatic. This really shows the extreme importance of a sufficient magnesium supply to keep your brain working properly. And also the minor cognitive dementia, so this is the first step to Alzheimer's, is reduced here by more than 50%. So 55%. So really this is a very significant effect, and this will, I'm very sure, will stimulate also other researchers to look more into magnesium and into the risk of magnesium deficiency connected to Alzheimer's disease. But this is new, this is from this year it was published. So, well, if you take all that together, you could have an idea that really the combination of a change in diet could have a positive effect in Alzheimer's disease. First is you need to have ketones in your blood as an alternative fuel. Second, you have to, if you do that, you have to avoid the acidosis. This can easily be done by giving an alternative, by giving an alkaline supplement. Third part is you need to have enough coenzyme Q10. You can supplement that. And fourth, you need to have enough magnesium. And this can be done by choosing an alkaline supplement with enough magnesium. Okay, and we did a study, a pilot study with some patients, and they were only supplemented for 4 weeks, so not a real long time. But what did we do? Well, we supplemented the coconut oil. This is an organic coconut oil, and well, patients had to use 40 grams of that per day. You can easily exchange, for example, your butter or your margarine with coconut oil, or you can cook with coconut oil. That's easy. Then it's Basica, and this Basica contains also magnesium, and the Qmax, this is a supplement with Q10, and this can easily be taken because it's water soluble, and you can simply dissolve it in a drink, or you can spread it over the food, so the intake is not a problem. What sometimes is a problem in elderly patients, also especially in Alzheimer patients, that they simply do not swallow the capsules or something. You have to give them something that is, you can mix into the food. So, and we did the clot test. The clot test is a typical test used in dementia patients. The task is you have a circle, and then the patients must draw a certain time, in this case 10 minutes after 11. And you see, these are different patients. You see if there is progressive Alzheimer's disease, it looks like that. So really, there's a problem, of course. You see it at once. And so this is one example. We did it, the test, the study, the pilot study, only with, not with Alzheimer patients. We did it with patients with early dementia. And so this is one example. You see, well, there is, of course, this is not correct, and now it is correct after 4 weeks. And, well, of course, you can have that also as summary, and this clock test improves by around about, in the population, improves by around about 30%, and also some other tests on dementia. There is an increase, but this increase means also an improvement, also around about 30%. So we have 2 different tests that show already within 40 days a significant improvement in these patients. And of 11 patients, 9 responded positively. So this is also interesting. You cannot only see the medium, you must see are there responders and non-responders. And we saw a high amount of responders.
The first, the column
goes down. This is improvement, and dementia is this. The more points you get, the better. And this is also an improvement. So you have in the beginning a low score, and in the after 4 weeks you have a better score. These are typical tests that are used in patients that are on the borderline with dementia.
Do you think it's long-lasting improvement?
That's we cannot say that because we haven't done the study with that. However, there are other studies, not with the combination of all, but there are studies on ketones, longer-lasting studies that show positive effects in most of the patients. The problem is that usually if you do the studies in patients that already have Alzheimer, well, to cure Alzheimer, you cannot expect that. They all show, or most of them show an improvement, but they are not getting normal anymore. There's irreversible damage in the brain, and you can't do anything with that. The point is, if you want to do studies in prevention, you need really large numbers. You have to treat 1,000 patients that are normal, and then you compare it to 1,000 persons that are also normal, and then you wait 5 years, and you see what happens. And you can imagine these studies are, well, these are tremendously complicated and very expensive, as you have to change the diet. And it's not easy to change the diet in patients or in persons that do not have a problem. So I'm a little skeptical if within a few years that we really will have these studies. They are very expensive, and also the pharmaceutical companies are not interested in that because it's food. It's just food and not, or some nutraceuticals maybe, but it's not a drug where you can have a patent on it and so. So you don't get millions of euros to do these studies, and we assume that we need round about 5 million euro to do a proper study on that. But I don't know, I don't have that, unfortunately. So we already had the summary. What is the strategy to prevent dementia? Well, okay, of course, it's coconut oil, and simply use it. Take it for cooking, take it for frying, and put it on your bread instead of butter. It tastes quite well, and you can easily adjust to that. You have to avoid acidosis by alkaline supplementation. You have, or to eat, of course you could also eat a very proper diet, but most people don't do that. And you need enough magnesium, you need Q10, and what's the last? You should reduce the carbohydrate intake, because this will also improve your metabolism in general. I would like to add something. Simply, if you have a relative or someone who has a problem with dementia, you can try it because it's not dangerous. It's not a drug that you test somehow. These are all substances that are very natural. You can simply see if it works, and if it does not work, you did not do any harm. And the chance that it works is quite high. And why do you want to wait 20, 30, 40 years till really the knowledge is so that you can see, well, it is absolutely important to do that. I'm very convinced. All the biochemical evidence is convincing. The pilot studies all around the world show that really all it's like a puzzle. All the pieces fit together, and if you do that, well, you will have significant improvement.
Okay, I have two, maybe three questions. One is regarding the coconut oil. There's the refined coconut oil that's mostly available, and the extra virgin that still has the flavor of coconut, but it's not refined. So is there a difference between these two types of coconut?
So the natural coconut oil is better. So, and especially if you take the organic,
Yeah.
you should use, I would really suggest to take organic coconut oil,
That is
because
not
the
It still has
pesticide, the
flavor
amount of
plain
pesticides
coconut.
is much lower, and it should not be refined and not hardened, because then some trans fats might also be produced.
But they are mostly available. So
Well, in Germany, in fact, this is not a problem anymore. And now in Germany, in every supermarket, you can find coconut oil, unrefined coconut oil. And if you go to an organic store or a farmhouse, bio market or something, then you can find it. So it's not a problem. And the costs, okay, it costs a little more than, of course, it costs more than normal oil. You must estimate round about 15 to 20 euro for a liter of coconut oil. That's the price in Germany. No, it depends on the temperature. It melts at around 24 degrees, 25 degrees. And so if you find the word coconut oil or coconut fat, it's the same. It's one in the cold and one in the hot.
The second question is regarding the magnesium. As far as I know, vitamin B6 is essential for the absorption.
This is simply marketing. This is simply because there's a big producer that has a product, magnesium together with B6, but there's no need for that. First, there is no shortage in vitamin B6 in our societies, in our diets. There's no problem with that. And if you would argue that you need B6 to use magnesium, then you need 20 other substances also. Why exactly B6? It doesn't make sense. And so I would say either you eat a proper diet, most people don't, unfortunately. So then you can supplement magnesium, and then it is important to supplement the magnesium that is has a good bioavailability, and magnesium citrate is good in that, but also Basica is very effective in that.
Third and the final question. You said that we should decrease the intake of carbohydrates.
Yeah.
What is the recommended proportion of, because it decrease to what level? So
decrease means don't overload your metabolism with carbohydrates.
That's okay,
well,
but it can be 30%, it can be 50%, it
no,
can
no,
be 60%,
it's
whatever.
more, it's more in the area of 40% something. Okay. But this is complicated. Well, do you know how many percent of carbohydrates you eat? I would say simply reduce the amount of bread you eat, amount of pasta you eat, especially amount of sweets you eat. Then you're on the right side. Then it's not a problem. Eat less bread, less sugar, less sweet drinks. That's especially in our youth. That's a big problem. And all these Cokes, all this soft drinks, it's a disaster, I would say.
Decrease carbohydrates, one of the first slides, and there is the brain is receiving fuel energy from carbohydrates. So if we decrease,
You cannot decrease it to zero. This is impossible. You cannot eat only fat. It doesn't work. And you still, also in Alzheimer's disease, still the brain needs around about 40 to 50% of the energy from glucose. You cannot switch the brain to 100% ketones. So you always need some carbohydrates. The point is, however, we can produce carbohydrates also ourselves from protein. But this is only rare cases. Our usual diet has enough carbohydrates. So eat less bread, eat less sweets, then you're on the safe side.
Yes, I just wanted to ask, I have coenzyme Q10. Coenzyme is just a trade name, is it, or a company?
No. Coenzyme, it is a coenzyme. It is a cofactor for some enzymes in the metabolic parts in the mitochondria.
But
So
Q10 is the important.
Q10, it's not a, coenzyme simply means it's a cofactor to an enzyme. But the important point is that also magnesium is a coenzyme, as it's a cofactor for enzymes. But well, it's just usually it's only well, I think it's tradition since it's named coenzyme Q10. You could also say just Q10 without coenzyme. You don't need that. It's a description.
Magnesium usually is right on the bottle, but it's
It's magnesium and with Q. But if you buy Q10, it should be also written Q10.
Decrease of carbohydrates perhaps means decrease of refined carbohydrates.
Yes, mainly. Avoid sugar, avoid flour, white flour, and so this is it's not that you have to cut it to zero, but simply eat less of it. Improved. Yes. But this is mainly politics. This is not science. What the WHO suggests has also tremendously something with economical aspects to do, as they suggest things that are available, what I understand. We cannot say to all people in the world, eat less carbohydrates. This will not feed the world. That's a very, very big problem. We have a problem. We have a very, well, we are in our part of the world, we are wealthy, relatively, and we can eat a diet that is rich in protein and so on. And in some other parts in the world, they would be happy if they would have our problems. Thank you very much for your attention.